Good afternoon to everyone. Today, my seminar presentation about MNS blood group system. My moderator, Dr. Nidhi Sharma ma'am, Assistant Professor, Department of Transfusion Medicine. Myself, Dr. Vignesh, first year resident. MNS blood group system is the second blood group system. It is discovered after ABO blood group system. Landsteiner and Levin started immunizing rabbits. During that immunization, antibodies recovered from rabbit serum. It's named as anti-M and anti-N, reported in 1927. S antigen was discovered by Walsh. It's genetically linked to M and N antigen. Its antithetical partner, small s, was discovered in 1951. 50 antigens are present in MNS system present now, but MNS antigens are most common. In 1953, the universal antigen U was discovered by Weiner. The prevalence of MNS phenotype. The phenotype prevalence of minus blood group antigen is Indian blood donors. So particularly the M antigen in 87.2%, the N antigen 62.9%, S antigen 54.2%, small s antigen 88.2% in Indian population. 50 antigens have been included in MNS system. It almost equal to RH blood group system. Most of the antigens are low prevalence, but it's mostly discovered during hemolytic incompatible crossmatch and hemolytic disease of fetus or newborn. MNS blood group has been assigned ISBT number 2. It's simple MNS. It's a basic concept about MNS system. M and N antigens are found on well-characterized glycoprotein called glycoporin A. The CD number is CD235A. The glycoporin A is like a sialic acid rich glycoprotein. Capital S, small s and U antigens are found in well-characterized glycoprotein is called glycoporin B. CD number CD235B. Glycoporin A is very abundant with about 1 into 10 power 6 copies per red cell. The glycoporin B is less abundant with only 20,000 copies per cell. It's a RBC membrane contains glycoporin A and glycoporin B. Glycoporin A, M and N antigen attached with glycoporin A. M and N only differ in their amino acid sequence position 1 and 5. In glycoporin B, U antigen is attached, but U antigen is directly attached with the glycoporin B. Capital S and small s antigens attached with the U antigens, not directly attached with the glycoporin B. Capital S and small s only differ in their amino acid sequence at position 29. The difference between glycoporin A and glycoporin B. Glycoporin A carries M and N antigens. It consists of 131 amino acids, 3 portions. Extracellular hydrophilic contain 72 amino acids. Transmembrane hydrophobic contain 23 amino acids. Intracellular hydrophilic contain 36 amino acids. The glycoporin B, it carries capital S, small s and U antigens. It consists of 72 amino acids, 3 portions. Extracellular hydrophilic contain 44 amino acids. Transmembrane hydrophobic contain 20 amino acids. Intracellular hydrophilic contain 8 amino acids. The genes glycoporin A and glycoporin B, which codes for glycoporin A and glycoporin B, MNS antigens. So located on chromosome 4. Glycoporin A is organized to 7 exons. Glycoporin B has 5 coding exons and 1 non-coding exon. Now we see about M and N antigens. M and N antigens are located at the outer end of glycoporin A. It is easily destroyed by enzyme like physin, papain and bromelain. M and N antigens shows dosage effect. Dosage effect means in homozygous conditions lot of antigens are present in the surface of RBC. In a heterozygous condition, different antigen present on the surface of RBC. So antibodies strongly react with the homozygous condition because of lot of antigen present in homozygous condition. So easily reaction happens. M and N antigens are antithetical or differ in amino acid residues at position 1 and position 5. M antigen is defined by serine at position 1, glycine at position 5, but N has leucine and glutamic acid at these positions. Capital S and small s antigens. Capital S and small s antigens are located in glycoprotein B. They are differentiated by the amino acid at position 29. Methionine defines capital S and threonine defines small s antigens. M and N antigens are not easily degraded by enzymes because the antigens are located further down the glycoprotein because of not directly attached to the glycoprotein. U antigen is not directly attached to the glycoprotein. Capital S and small s antigen attached with the U antigen. Both M and N and capital S small s antigens are well developed at birth. This is amino acid sequence. M and N antigens 1 and 5th position. In capital S and small s antigens different in 29th position. Lysine, papain, bromelain, pronase, chymotrypsin can destroy capital S and small s activity, but the amount of degradation depends on the strength of the solution. Trypsin does not destroy capital S and small s antigen. M and N, capital S, small s and U antigens are not detected on the lymphocytes, monocytes, granulocytes and platelets. U antigen is a for universal antigen. It is located very close to RBC membrane between amino acids 33 and 39. The RBCs are usually S negative, small s negative, U negative type. It means U antigen negative in glycoprotein B. Capital S and small antigens also negative in glycoprotein B. U antigen is resistant to enzyme treatment. Effect of enzyme treatment on the MNS antigens. First we see about trypsin. Trypsin catalyzes the hydrolysis of peptide bonds on the carboxyl side of lysine and arginine residues. There are at least 7 trypsin cleavage sites on glycoprotein A. The purified glycoprotein B may be cleaved by trypsin at amino acid residue 35, but trypsin treatment on intact cell does not denature glycoprotein B. Chymotrypsin. M and N antigens on intact cells are partially resistant to chymotrypsin treatment. The treatment of red cells with sialidase followed by chymotrypsin results in abolition of M and N antigens activity. But in the capital S antigen is denatured by lower concentration of chymotrypsin than small s antigen. Papain, lysine, bromelain, pronase. Most glycoprotein A and glycoprotein B bound antigens are destroyed by treatment of red cells with these enzymes. Papain or lysine treatment of cells readily destroys M, N and small s antigens, but capital antigen is less easily abolished. Sialidase. Glycoprotein A and glycoprotein B carry about 15 and 11 O oligosaccharides respectively, most of which contain 2 molecules of sialic acid. Glycoprotein A contain more amount of sialic acid, so we need more amount of sialic acid content. So we need more amount of sialidase required to remove sialic acid from glycoprotein A. The Miltenberg series. Miltenberg series is a phenotypes that are rare in most population and are associated with the MNS system. Miltenberg antigens are belong to complex MNS blood group. They are most likely evolved from specific gene mutation or crossover events of homologous glycoprotein A, glycoprotein B and glycoprotein E. So Miltenberg series tablet column. Previously 4 classes are now present in Miltenberg series. Now 6 classes added. These are new notations. These are antigens. Now the Miltenberg series is absolute. Other phenotypes. ENA negative phenotype. ENA is high incidence antigen. The rare null phenotype of the system which lacks MN antigens, loss of glycoprotein A, results from homocyclicity for gene deletion at the glycoprotein A locus. Subsequently, no glycoprotein A is produced, but glycoprotein B is not affected. In MK phenotype, it's opposite to the EN negative phenotype. It's both deletion of glycoprotein A and the glycoprotein B. It's a null phenotype in MNS system. There are typed with M negative, N negative, capital S negative, small s negative, U negative, En A negative. MK genotype is associated with decreased RBC sialic acid content but increased glycosylation of RBC membrane bonds 3 and 4.1. Next we see about antibodies. Anti-M. Anti-M is relatively common. It's a naturally occurring antibody. It reacts below 37 degrees. It shows dosage effect. M antibodies are mostly IgM but frequently contain IgG component also. They do not bind complement, do not react with the enzyme treated RBCs. It appears more common in children and in patients with burns. Anti-M is rarely clinically insignificant. Anti-M does not react with 37 degrees. Anti-M are pH dependent. It's reacting best at pH 6.5. These antibodies are maybe detected in plasma, which is slightly acidic from the anticoagulant, but not in acidified serum. Anti-M rarely cause transfusion reaction, hemolytic disease of fetus or newborn, decreased vessel survival. Anti-M, this antibody is very rare, most likely because of immune tolerance induced by N antigen on glycoprotein B. It's a cold IgM. So IgG is saline activity that does not bind complement or react with the enzyme treated RBCs. Anti-N also show dosage effect. Anti-N antibody is not clinically significant. The most potent antibodies are found in individuals. Say M positive, N negative, capital S negative, small s negative, U antigen negative, and log both N, positive and negative N. Anti-N is also seen in renal patients who are dialyzed on equipment sterilized with formaldehyde. The dialysis associated anti-N reacts with any N positive or N negative RBC treated with formaldehyde is called a new antibody, anti-NF antibody. It's also anti-N antibody is not clinically significant because anti-NF does not react at 37 degrees Celsius. It reacts below 37 degrees Celsius. Anti-capital S and anti-small s antibody. The antibodies to capital S, small s and U usually occur after exposure to allogenic red cells. All are capable of causing transfusion reaction, hemolytic disease of fetus or newborn. Both are anti-S and capital anti-S, small anti-S, both are reacted above 37 degrees Celsius or at 37 degrees Celsius. These antibodies may show dosage effect, but it's not compared with anti-M and anti-N, its dosage effect is very minimum. The antibodies may not react with the enzyme treated RBCs depending on the extent of treatment and the efficiency of the enzyme. The difference between anti-M and anti-N and anti-capital S, anti-small s and anti-U. The anti-M and anti-N antibodies are naturally occurring antibody, but anti-S and anti-U exposure is required. The anti-M and anti-N antibodies are mostly cold IgM, but anti-M antibody also content of IgG also is there. Anti-M and anti-N shows dosage effect. Anti-S and anti-U also show dosage effect, but a minimal dosage effect. The anti-M and anti-N antibodies are clinically insignificant, but capital anti-S, small anti-S and anti-U antibodies are clinically significant. It causes transfusion reactions, hemolytic disease of fetus or newborn. It's easily anti-M and anti-N antibodies are IgM antibodies. It does not cross placenta, but capital anti-S, small anti-S and anti-U antigens are IgG type of antibodies. It easily cross placenta, so to cause hemolytic disease of fetus or newborn. It's an antibody. Anti-M and anti-N have IgM. Anti-M also have IgG. And capital anti-S, small anti-S and anti-U. These are IgG antibodies. Anti-M and anti-N are no clinically significant, but capital anti-S, small anti-S and anti-U are clinically significant. Disease associations with the MNS antigens. Glycoprotein A surface receptor by certain phylonephrotogenetic strains of E. coli gain entry into the urinary tract. Plasmodium falciparum appears to use alternative receptors including glycoporin A and glycoporin B for cell invasion. Influenza virus used glycoporin A as receptor. Thank you. These are my references. Thank you.